Hey everyone, welcome back for another deep dive. Today we're going somewhere a little different. We're heading over to India, to Rajasthan, to take a look at their healthcare system.
Interesting choice.
Yeah, and you might be thinking of Rajasthan and picturing like those palaces, those sweeping deserts, right?
All right.
The whole vibe. But what's really fascinating is that the healthcare scene in Rajasthan tells a completely different story. It's got its own unique set of challenges.
Yeah, it really does. What's interesting is that Rajasthan is actually India's largest state.
Oh wow, I didn't realize that.
Yeah, so just imagine trying to provide adequate healthcare across a landmass that massive. It's huge.
It's like trying to create a healthcare safety net, but like the size of a small country.
Yeah, exactly. And it's not just the size. You have to consider about 75% of Rajasthan's population, they actually live in rural areas.
Oh, wow.
Often they're scattered across these vast, arid landscapes. And then you add in the extreme weather conditions like scorching deserts, and you start to see how just getting to a doctor can be a monumental task for a lot of people.
Yeah, so we're not even just talking about like a lack of hospitals. It's the distance, the terrain, the climate.
It's everything.
It's like a perfect storm of obstacles standing in the way of getting healthcare.
And these obstacles, they have very real consequences.
Yeah.
If we look at some key health indicators, we see that infant mortality in Rajasthan is 32 per 1,000 live births, while maternal mortality stands at 113 per 100,000. Now, to put that into perspective, those figures are significantly higher than the national averages for India.
Wow, so you're saying that just by living in Rajasthan, mothers and infants are at a statistically higher risk just for being there?
It is a stark reality, but it's important to note that the government is very aware of these challenges.
Okay, good.
They've actually implemented some pretty ambitious initiatives to try and level the playing field.
Okay, so they're not just ignoring the problem. What are they actually doing to make a difference?
Well, one standout example is the Mukhyamantri Chiranjeevi Yojana.
Okay.
It's a program that provides free healthcare up to 10 lakh per year for families.
Okay, and how much is that in dollars?
Well, that's about over $12,000,
Wow, okay.
which is enough to cover a wide range of medical procedures and treatments.
So for a lot of families, this is a lifesaver.
It really is. For many, it is.
Okay, so it's not just throwing money at the problem, though, right? There's got to be a broader strategy.
Oh, absolutely. It's definitely not just about one program. Rajasthan is also actively utilizing that National Ayushman Bharat scheme,
Okay.
which is a health insurance program that covers something like 4.4 million families in the state.
So they're combining financial aid with insurance coverage. That's a two-pronged approach to accessibility.
Exactly. And they're not stopping there. They're also embracing technology
Oh, interesting.
to try and bridge those geographical gaps we talked about.
Okay.
So through this platform called the AIinHealthcare platform, they're connecting people in these remote villages with doctors in cities through telemedicine.
It's like bringing the doctor's office to their doorstep, even if it is virtually.
Exactly. And then on the ground level, they've established a network of over 17,000 health subcenters, which act as primary points of contact for these basic healthcare services. And then on top of that, they rely heavily on these AIinHealthcare workers.
Okay.
And these AIinHealthcare workers are typically local women who are trained to provide these essential healthcare services, particularly maternal care in remote villages.
And so they're like the boots on the ground, the ones who are actually there.
They're often the only link to healthcare that these rural communities have.
It sounds like they're building a pretty comprehensive system, from financial aid and insurance to on-the-ground clinics and these tech-driven solutions. But I have to imagine, even with all these efforts, a state as vast and diverse as Rajasthan is still going to face some pretty serious hurdles, right?
Oh, you're absolutely right. It is not all smooth sailing. The sheer scale of the task managing resources across such a vast and varied landscape is a challenge in itself.
Yeah. And then we have that doctor shortage that we talked about earlier.
That's a major obstacle.
Doesn't help.
No. The World Health Organization recommends one doctor for every 1,000 people. In Rajasthan, that ratio is closer to one doctor for every 2,500 people.
Wow. That's a huge discrepancy.
It is. More than double the recommended figure.
So what does that actually mean for people living in these underserved areas?
Well, you're going to have longer wait times to see a doctor, limited access to specialists. potential delays in getting necessary treatments, all these things that can have a significant impact on health outcomes.
Yeah, that's tough. And I imagine it's not just the availability of doctors.
You're right.
There's got to be other factors at play, too.
Absolutely. We have cultural preferences for traditional healers. Sometimes that leads to delays in people seeking formal medical attention. And then you layer on the administrative hurdles.
Yeah.
Navigating funding gaps and bureaucratic delays can make it really tough to implement these national healthcare programs effectively at a local level.
So even with the best intentions and impressive programs in place, you still have this complex web of challenges to untangle.
That's true. But it's not just about the government's efforts. We can't forget about the private sector. They play a crucial role in Rajasthan's healthcare landscape.
Oh, right. How do they fit into this?
They provide actually around 60% of healthcare services in Rajasthan,
Wow.
especially in the urban areas like Jaipur.
So it's almost like we're talking about two different healthcare systems, a more robust one in the cities and a struggling one in those rural areas.
In a way, yes. While cities might offer more options, rural communities often rely on smaller private clinics, which can be expensive and might lack the resources of the larger hospitals.
Yeah, so the same geographic and economic disparities that we see in the public sector are basically mirrored in the private sector, too.
Unfortunately, that's often the case. You have high operating costs and limited insurance penetration in those rural areas, which makes it hard for private providers to offer affordable and comprehensive care.
So we've painted kind of a complex picture here, right? The government is striving for this universal coverage. The private sector is navigating its own unique challenges, all this happening against a backdrop of geographic and economic disparities. But are there any signs of progress, any innovative approaches that are giving people hope?
Oh, absolutely. There are some truly exciting collaborations and innovations happening in Rajasthan.
Okay, I'm ready to hear about the glimmers of hope. What's working?
Well, one thing that's emerging as a key strategy are these public-private partnerships, or PPPs as they're called.
Okay.
They're combining the resources and expertise of both sectors to tackle some of these seemingly impossible challenges.
So what does that actually look like on the ground?
Well, one great example is the Sanjeevani vans.
Sanjeevani vans. What is that?
Imagine mobile health units
Okay.
that travel to these remote villages, providing essential healthcare services and screenings.
Oh, wow. So it's like a doctor's office on wheels.
Yeah, these vans, they reach hundreds of villages every month, bringing healthcare to people's doorsteps.
That's a great way to overcome those geographic barriers.
Exactly. And technology is playing a crucial role, too. We're seeing startups that are using AI to detect tuberculosis in those hard-to-reach areas,
Wow.
which could have a huge impact on controlling the spread of the disease.
So it's like they're embracing every tool at their disposal to reach the people who need it most.
And it's not just about technology. Community engagement is absolutely vital. NGOs are partnering with local leaders to boost immunization rates, particularly in those tribal communities.
So you really need that grassroots effort.
Yeah, building trust and working within those existing social structures. It's crucial for effective healthcare delivery.
So it seems like these collaborative efforts, this blending of the public and private resources and this strong community focus, is bringing some hope to what seems like a very challenging situation.
It absolutely is. It really highlights the power of working together to overcome these complex problems. It's a reminder that no single entity can solve this alone.
Yeah.
It takes a collective effort.
So we've covered a lot of ground here, the immense challenges, the government's initiatives, the role of the private sector, these inspiring collaborations. But what does the future hold for healthcare in Rajasthan? Where do we go from here?
That's a great question. And it leads us to the next part of our deep dive, exploring the road ahead for healthcare in Rajasthan. What are those long-term solutions? Where does the investment need to happen? What are those strategies that can truly transform the healthcare landscape?
All right, I'm ready to hear about these potential solutions, this path towards a healthier future for the people of Rajasthan. Lead the way.
Let's do it. When we think about the future of healthcare in Rajasthan, there's one really important building block we have to consider, and that's education.
Yeah, education makes sense. I've always heard knowledge is power, but it seems especially true when we're talking about your health, right?
Absolutely. Investing in health literacy is critical, particularly for women.
Okay.
Unfortunately, the female literacy rate in Rajasthan is only around 57%.
Wow, that's a lot lower than I would have guessed.
Yeah, it's considerably lower than the national average.
I imagine that has a ripple effect across their whole healthcare system.
Oh, absolutely. When people understand the importance of things like preventative care, early detection, proper treatment, they're empowered to make informed decisions about their own health.
So it's not just about building more hospitals. It's about giving people the knowledge to be proactive about their well-being.
Exactly. Education lays the groundwork for a healthier society. Now, while education empowers individuals, we also can't forget about the critical need for robust infrastructure.
Right.
We talked about the doctor shortage, particularly in rural areas.
Yeah.
How do we tackle that?
Yeah, how do you attract doctors to those areas, especially when they might have, more appealing options in bigger cities?
It's a challenge for sure. Strengthening primary healthcare centers is essential. They need to be well-equipped and staffed to provide a wide range of services.
But how do you make those rural postings more appealing?
Mm.
Like, what would make a doctor choose a small village over a big city?
Incentives are key. Offering financial incentives, providing better housing and living conditions, ensuring career development opportunities for doctors who choose to serve in these underserved areas.
So it's about creating a package that addresses both the professional and the personal needs of doctors.
Right, make it a win-win for everybody. But we can't stop there. Technology has such transformative power. We touched on telemedicine before.
Right.
But its potential goes far beyond just those virtual consultations.
Okay, now I'm intrigued. Give me the tech-savvy vision for healthcare in Rajasthan.
Imagine this. Remote villages. They have access to specialists in cities through these virtual consultations. You have AI-powered diagnostic tools that can detect diseases much earlier and with more accuracy, mobile health apps that can track patients' progress, provide personalized health information, even send reminders for medications or follow-up appointments.
It's like teleporting the expertise and resources of a modern hospital to these far-flung corners of the state.
It really is amazing, but technology alone isn't enough.
Right.
We need to make sure that everyone has access to that technology.
Yeah, that's a good point. Like, what good is a cutting-edge telemedicine platform if people can't even get online?
Exactly. Digital inclusion is critical. We need to invest in internet infrastructure, digital literacy programs, affordable devices, so that everybody can benefit from these advancements.
It's like building a high-speed rail system, but nobody can afford the tickets.
Yeah, that's a great analogy. And lastly, we can't forget about the importance of policy and collaborative models.
So you're talking about things like Aroja Rajasthan, right? The one is aiming for universal health coverage by 2030.
That's the one. Aroja Rajasthan has this comprehensive and ambitious vision for the future of healthcare in the state. They prioritize preventative care, strengthen primary healthcare, foster partnerships between the government, the private sector, and civil society.
So they're attacking this problem from all angles.
Yeah.
Prevention, infrastructure, collaboration.
Exactly. The program recognizes that to achieve universal health coverage, you need system-wide transformation, not just these little isolated interventions.
So it's about weaving together education, infrastructure, technology, and policy into this coordinated, sustainable system.
It's about creating a healthcare ecosystem where everyone in Rajasthan, no matter where they live or their economic status, has the opportunity to live a healthy life.
It makes me wonder what could be accomplished if every state or even every country had a program as ambitious as Arogi Rajasthan.
That's a powerful question. It's one that we should all be asking. It challenges us to think critically about the systems we have in place and how we can create a world where healthcare is a right, not a privilege.
This has been really eye-opening learning about the complexities of healthcare in Rajasthan.
Yeah.
We've learned about the challenges, the innovations, the aspirations of the people who are working to improve the system. But what are your final takeaways?
That's a great question. Let's wrap up this exploration of healthcare in Rajasthan and see what insights we've gained.
It's amazing to see that even with all these challenges, people are still finding ways to make things better.
It really speaks to the resilience of people.
It does. And those public-private partnerships we talked about, the mobile health units, using technology to reach those remote areas, it shows what we can accomplish when we work together.
It really emphasizes that no one person or organization can solve a problem this complex. It takes real coordination to combine everyone's strengths and tap into the community.
And that focus on education and health literacy, it seems like that's a big part of creating long-term change.
Absolutely. When people are equipped with knowledge, they're empowered to make informed decisions about their health. Which brings to mind a really interesting question.
Okay.
Remember the Mukhyamantri Chiranjeevi Yojana, the program that provides free healthcare up to 10 lakh?
Yeah, over $12,000.
Right. What if every state or even every country had a program like that?
That's a big question. What kind of impact would that have on people's lives?
It really makes you think about what's possible when everyone has access to healthcare.
It does. We've learned so much about the healthcare system in Rajasthan in this deep dive.
We have. We've seen the challenges of the innovations and met the people working to make things better.
And hopefully this has inspired you to learn more about healthcare in your own community.
And think about how you can help create a world where everyone has the opportunity to be healthy.
Thanks for joining us on this deep dive into healthcare in Rajasthan. We'll see you next time.